Hello everyone, I'm Dr. Sanjay Sachdeva, ear, nose, throat consultant from New Delhi. The topic that we are going to discuss today is all throat infections are not COVID. Sore throat is a fairly common symptom in our day-to-day practice. Nowadays, of course, if one complains of sore throat, one fears, do I have COVID? Center for Disease Control and Prevention, as we call it CDC, initially listed only 3 symptoms under COVID-19. They were cough, fever, and shortness of breath. Now, with more information coming from various countries, 6 more symptoms have been included. They are chills, muscle pain, headache, sore throat, and loss of taste and smell. Present data shows that sore throat as a symptom occurs in only 10 to 12% of COVID-19 patients. So now if one complains of sore throat, there could be other non-COVID diseases as well one can be suffering from. And we will go through some of these now. If you have a sore throat but otherwise you're feeling fine, except for just a little runny nose, it is more likely that you have seasonal allergy, especially if you have an old history of allergy. Children with allergies to pollen, which is quite common during this season, may develop swelling and dark patches under the eyes. These are known as shiners. If the swelling increases, wrinkles may also appear in young children. Constant rubbing of the nose these children can do, and because of the itching that they feel in the nose, can produce a skin crease over the nose, which can be seen very clearly by a clinician. Sneezing and itching in the nose and palate usually are not a sign of COVID-19. But if one develops fever with sore throat, then it may not be allergy and needs to be further investigated. Influenza or flu has been with us for a long time. The source of H1N1 strain of influenza is still debatable, but it began spreading during World War I. The initial symptom of influenza and COVID-19 may be almost matching, such as fever, cough, shortness of breath, but influenza occurs much faster and more rapidly than in COVID-19. It is critical to remember that there is a vaccine for influenza and Tamiflu is a drug which can be helpful. However, if one has muscle pain, loss of smell and taste, in addition to symptoms which are mimicking influenza, these may point towards COVID-19. Common cold, in contrast, is caused by many different types of viruses. The symptom of sore throat is common to all, but the condition is generally harmless and usually resolves in 2-week time. Treatment normally consists of anti-inflammatory and decongestant drugs. Cough syrups should be avoided in children below age of 4, and antibiotics are certainly not recommended for common cold unless you are thinking of a secondary infection which can occur later. Plenty of water helps. Adjusting room temperature and humidity is mandatory. Soothing the throat with saltwater gargles are recommended. Usually nasal saline drops help relieving nasal congestion. Alternative medicines may also be helpful. Vitamin C, zinc, echinacea are age-old remedies for cold, and they can be tried. However, cold with other symptoms may need further investigation during these times. There are other viral conditions which can also present with sore throat. They are herpes, measles, and conditions like infectious mononucleosis, which is also known as kissing disease as it is transmitted by saliva. However, sore throats may not be caused by viruses alone. Bacterial infections are also known to present with soreness in throat, and strep throat is an example. Strep throat is caused by bacterial infection producing severe pain in the throat and difficulty in swallowing and fever. And this needs immediate antibiotics, analgesics, bed rest and hydration. If it is not treated properly, it can lead to local abscesses which might even require surgery. It can also may have sinister implications in terms of rheumatic fever, kidney and heart problems which can happen after strep throat. And if you see pus in the tonsil, that is more likely to be indicative of strep throat and not COVID. In conclusion, while COVID cases are rising in our country, one need not worry if they only have a sore throat. As I mentioned earlier, there could be several reasons causing sore throat during this season. However, one must look for COVID-specific symptoms, especially defined by CDC. Sore throat in COVID, just like other viral infections, have to be treated symptomatically. Take plenty of water, add supplements such as zinc, vitamin C and D to boost immunity. Avoid outside food and take plenty of rest. That would certainly help you in taking care of your soreness in throat, even if it is COVID-19.